President, Director General Tedros, Excellencies, distinguished delegates, ladies and gentlemen. C'est un honneur pour moi de prendre la parole aujourd'hui au nom du gouvernement du Canada. Before I begin, I would like to applaud the work being done by both Director General Mueller and Director General Tedros to promote a culture of respect in the United Nations. Canada supports these efforts. I also want to reaffirm that Canada upholds the principles of universality in addressing health issues and global health inequalities, and recognizes the transboundary nature of disease. As such, we believe it's important that all members of the global community be part of discussions on global health. Il y a 40 ans cette année, le monde a
40 years ago this year, we met in Alma Ata to affirm its determination to act for the health of all, to define this as to ensure best possible mental health as well as social and physical health. We have seen much progress in this time. The Government of Canada since then has adopted a law for medical care to ensure universal health coverage for all. 20 years later, which is the law on health, guarantees a national standard for care within Canada for all its citizens. Today, this is one of the symbols of the Canadian identity. Each citizen can be proud of the results we have seen in the last decades. Diseases that killed millions of people previously have been eradicated today. We're not just talking about physical well-being. We have a lot remaining to do. We must ensure that we do the same for mental health. Since my work has been ongoing in this area, I've seen many people suffering, but also I've seen their families and their nearest and dearest suffering, as well as their community. Anyone can suffer from mental health problems. Today, I am in a very different position than I was previously. I can support my experience with the experience of my government to ensure the leadership of our Prime Minister, Mr. Pierre Trudeau, to ensure that mental health care is a priority. Health care is ensured mainly by territories and provinces. We have many agreements supporting this to invest directly in mental health care services and those who need assistance or those who are suffering from drug abuse and use. Medical health support is supported with the Community of Canada, as well as physical health. We're supporting mental health in this way.
Mental health services in Canada continues to be a challenge. We know that investing in services is only half of the battle and that we must do more to fight stigma. Stigma is more than words. It has a major impact on the lives of those with mental illness and all too often keeps those who need treatment from getting it. Our government is making every effort to include the perspectives of those with lived experience as we raise awareness of stigma surrounding people who use drugs and people with mental illness. Having spent years in the field, I know that combating stigma necessitates listening to these voices. Yet, mental illness is not a uniquely Canadian issue. It's truly a matter of global health. Just as the world came together over the last century to tackle what seemed to be unsurmountable problems, today we must unite against mental illness. Our efforts are guided by the United Nations Sustainable Development Goals, which sets targets to ensure physical, mental, and social well-being of people worldwide. 5 years ago, here in this room, we also adopted the Comprehensive Mental Health Action Plan for 2013 to 2020. Member states from all regions of the world agreed to a common vision and defined targets for mental health. More recently, at the United Nations Commission on Narcotic Drugs, Canada and 19 of our allies agreed on a resolution to eliminate the stigma faced by people who use drugs. Each of these initiatives is a significant step forward, yet we must recognize that there's still work that needs to be done outside of the health sector, and that everyone has a role to play. Mental illness is among the most critical global health challenges of our time. It is incumbent upon each and every one of us to consider how our nations, what we'll do, and how we will rise to the challenge. And Canada is absolutely determined to play its part. Last night, I was pleased to join my colleagues from Australia and the United Kingdom in launching the Alliance of Champions for Mental Health and Wellbeing. With members from all regions of the WHO, this alliance will raise the profile of mental health. I call on you to join us. In the past century, the world has come together to tackle smallpox, polio, measles, with the results to prove it. 100 years from now, I can only hope that the same will be said about mental illness. Thank you. On behalf of the region of the Americas, this year's theme, Health for All, Commit to Universal Health Coverage, highlights a top priority for our region. Ours was the first region to adopt a strategy on universal access to health and universal health coverage. This strategy supports our commitment to access without discrimination to comprehensive, timely, and quality health services. It also sets targets and addresses the challenges we face in advancing universal health coverage. We recognize the progress made by several countries in the region to achieve universal health coverage and to sustain quality services, and will continue to share what we learn, both challenges and successes, with other regions. To support implementation of the Sustainable Development Goals, the region recently adopted the Sustainable Health Agenda for the Americas. It outlines our shared vision for health in the region. More than this, it is a call to action, urging us to work together to achieve higher levels of health and well-being. We will continue to collaborate through multi-sectorial actions to achieve the highest attainable standards of health for all people throughout the life course. The implementation of a human rights-based approach to health, the promotion of equity and well-being are prime features of these efforts. We can all be proud of our successes, but we must also recognize our challenges. The elimination of smallpox and polio, for example, are important achievements. Our challenge is now to safeguard the gains we have made and prevent the re-emergence of formerly eliminated diseases such as the measles. Now, more than ever, protecting our populations from vaccine-preventable diseases is crucial, considering the frequent movement of people across the regions. So more than ever, we need to make this a collective priority. Non-communicable diseases is a main cause of premature death and preventable morbidity in the regions of the Americas and around the world. We need to address major risk factors that contribute to avoidable NCD deaths by promoting healthy lifestyles, mental well-being, and comprehensive multi-sectoral approaches, strengthening the implementation of evidence-based and cost-effective interventions according to national priorities. We need to tackle the root causes of disease by promoting healthy lifestyles and, bearing in mind national contexts, implementing appropriate regulatory, policy, and program interventions. We also need to continue working globally to promote access to safe, effective, affordable, and high-quality medicines. This is key to achieving universal health coverage. We acknowledge the important progress made by our regions on infant and maternal mortality. However, it still remains a challenge for some countries in the Americas. In response, our region is developing a plan of action on women's, adolescent, and children's health, which will be adopted in September at the next Directing Council. We understand that by advancing gender equality and the empowerment of women and girls in our region, we can reduce poverty and build more inclusive, peaceful, and prosperous societies. As a region, we want to emphasize the importance of universal health coverage and promoting healthier populations as two of the 3 strategic priorities in the 13th General Program of Work. We encourage these areas to be highlighted in the preparations of the 40th anniversary of the Declaration of the Alma-Ata. Together, our region faces a number of challenges, but we also share some considerable successes. With solidarity and multi-sectorial collaboration at the local, national, regional, and international levels, we can achieve the highest attainable standards of health and well-being for all people. Thank you very much. Merci beaucoup.
Thank you, Canada.